So question number 21, a pregnant woman arrives in the emergency department with abruptio placentae at 34 weeks gestation. She's at risk for which of the following blood dyscrasias? Is it heparin-associated thrombosis and thrombocytopenia, idiopathic thrombocytopenia purpura? Is it thrombocytopenia, or is it disseminated intravascular coagulation? Oh, hey, this is a good question, by the way. This is a good question. What do you think? And the answer is D, damn it. That's what I'm talking about. All right. The answer is D, disseminated intravascular coagulation. All right. Abruptio placentae is a cause of DIC because it activates the clotting cascade after hemorrhage. That is reduction of risk potential 9 to 15% on the NCLEX exam. All right, making it the fourth largest section on the NCLEX exam. Question number 22. A 16-year-old patient involved in a motor vehicle accident arrives in the emergency department, unconscious and severely hypotensive. He's suspected to have several fractures of his pelvis and leg. Which of the following parenteral fluids is the best choice for his condition? Is it packed red blood cells? Is it 0.9% sodium chloride? Is it lactated ringers? Or is it FFP? I'm sorry, fresh frozen plasma. All right, so let's think about it. He's unconscious and severely hypotensive. Why? But the answer is A, packed red blood cells. In a trauma situation, the first blood product given is an unmatched O negative packed red blood cells, right? Why? Who can tell me why? I want to see it down in the comments, right? A physiological adaptation. This is so entertaining. Good, I'm glad, right? Blood loss, true. There you go. Physiological adaptation, 11 to 17%, third largest section on the NCLEX exam. All right, bleeding, blood loss, emergency, hypotension. That's what it said. It said he was hypotensive, right? Right, bone fractures. But the biggest thing is that he was hypotensive, right? He was unconscious and he had injuries in his pelvis. Universal donors, massive blood transfusion, right? Universal donor, oxygen carrying cells. That's what I was looking for. Oxygen carrying cells. All right, here we go. Question number 22. Corticosteroids are potent suppressors of the body's inflammatory response. Which of the following conditions or actions do they suppress? Is it Cushing syndrome, pain receptors, immune response, or neural transmissions? What do we think? And the answer is C, immune response. All right, corticosteroids, all right, suppress eosinophils, lymphocytes, and natural killer cells, inhibiting the natural inflammatory process in an infected or injured part of the body. This helps resolve inflammation, stabilizes lysosomal membranes, decreases capillary permeability, and depresses phagocytosis of tissues by white blood cells, thus blocking the release of more inflammatory material. That is part of pharmacological and parenteral therapies, which is the second largest section on NCLEX at 13 to 19%. Pharmacology, ladies and gentlemen, you got to know it. You got to know it. Pharmacology. All right. Question number 24. All right, a patient infected with HIV begins zidovudine therapy. Which of the following statements best describes this drug's action? It stimulates the immune response. It destroys the outer wall of the virus and kills it. It intervenes with viral replication. It promotes excretion of viral antibodies. What are we thinking? All right, but the answer is C. It interferes with viral replication. All right, inhibits DNA synthesis in HIV, thus interfering with viral replication. The drug does not destroy the viral wall, stimulate the immune system, and or promote HIV antibody excretion. Solid rationale. All right, some rationales are extensive and some are not, and that's okay. Pharmacological and parenteral therapies, 19% on the NCLEX, making it the second largest section on the NCLEX exam. All right, here we go. Question number 25. A 20-year-old patient is being treated with pneumonia. All right, he or she or a helicopter has a persistent cough and complains of severe pain on coughing. What could you tell him or her? Anyways, about to reduce their discomfort. All right. Is it hold your cough as much as possible? Place the head of the bed flat to help with coughing. Restrict fluids to help decrease the amount of sputum. Or is it to splint the chest wall with a pillow for comfort? What are we thinking? And the answer is D. All right. Splint your chest wall with a pillow for comfort, showing this patient how to splint his chest wall will decrease discomfort when coughing. That's part of basic care and comfort. Basic care and comfort, which is a lower section of the 8 client needs for the NCLEX pie, right? It's 6 to 12%. This is something that you learn in fundamentals or foundations of nursing, all right?